It's a very happy student. I'm going to be performing your cardiovascular exam today. Before we get started, I'm going to wash my hands. And then I'm going to start by taking your blood pressure. If I just have you relax your arm. I would make a note of the blood pressure, and I would also take it in the other arm, and I'm also going to take his pulse for 15 seconds. I would make a note of that. And then I'm going to have the patient stand up for me, and I would take the blood pressure again and take the pulse as well in both arms, and I would note orthostatic tilt would be positive if the blood pressure and systolic was a decrease by 20 millimeters of mercury or pulse increased by 30, or the patient became asymptomatic. You can have a seat now. So next I'm first going to do an inspection of the jugular with a pin light, noting the duration, diameter, amplitude, and location, and noting its position to the carotid and that it undulates upon inspiration. Can I have you take off your shirt for me, please? Alright, now I'm going to inspect the PMI, noting again its diameter, duration, location, and amplitude. And I'm also going to palpate. Sorry, my hands are cold. Starting in the PMI, the tricuspid, the pulmonic area, and the aortic area, and I'm feeling for any heaves, impulses, or thrills. Next I'm going to listen, starting out with the diaphragm, the pulmonic area, third intercostal space. Can you take a deep breath? Listening for a split S2 at the third intercostal space, the tricuspid, and the mitral. That was with the diaphragm, and now I'm going to use the bell. So I'm going to put very light pressure on and do the same areas. Take a deep breath. I was listening for the regularity of the rate and the rhythm, and noting any murmurs, gallops, clicks, or rubs. Next, I'm going to listen to the carotids for any bruits, listening with the bell. And there is no bruise noted. If I could have you lay down. Can I have you lay on your left side for me? I'm putting the patient in a left lateral decubitus position and listening to the mitral region for any gallops with the bell. And there are none. You can lay back on your back. Next, I'm inspecting, noting the diameter and location of the PMI. I'm also looking for any impulses or precordial heaves or impulses. I'm next going to palpate, starting with the PMI, tricuspid, pulmonic, and aortic, feeling for any heaves, impulses, thrills. Next I'm going to listen, starting out with the aortic, and the diaphragm of the stethoscope. The pulmonic. Third intercostal space, take a deep breath. Listening for split S2. The tricuspid. And the mitral. Going to listen to the same regions, this time with the bell, so very light pressure. Take a deep breath. So I was listening for regularity of the rate and the rhythm, if there were any gallops, clicks, rubs, or murmurs. Next I'm going to do the peripheral pulses, starting out with the carotid. The brachial. The radial. The femoral. Popliteal. Tibialis posterior. And dorsalis pedis. All peripheral pulses were full and equal bilaterally. I'm also inspecting the toenails, looking for any clubbing, pitting, or onychomycosis. Also noting that the capillary fills within 2 seconds. Looking at the skin, it is warm, moist, and smooth to the touch. Hair distribution is normal. There's no abnormal pigmentations, and there's no edema. Also moving to the fingernails, there's no clubbing, pitting, or onychomycosis, and capillary fills within 2 seconds. So that concludes the cardiovascular exam. So you can put your shirt back on, and that finishes our exam.